In this video, you will come to know about the risk factors and complications of low blood pressure. Risk factors of low blood pressure. Some lifestyle risk factors cause low blood pressure. Nutrient deficiency is a risk factor of low blood pressure. Anemia can develop from a decrease in the number of red blood cells or the concentration hemoglobin brought on by dietary deficiencies such as those in folic acid or iron. Sugar alterations is another risk factor of low blood pressure. Hypotension can result from changes in blood sugar, including those brought on by diabetes. Another risk factor of low blood pressure is eating habits. Some elderly individuals, particularly those who already have high blood pressure, may have postprandial hypotension, which is a sudden drop in blood pressure after a large meal. Your intestines' increased need for blood during digestion will result in reduction in blood flow to other body areas. A dramatic but brief drop in blood pressure will result from this. Another risk factor of low blood pressure is hydration. To avoid being dehydrated when exercising, make sure you consume the recommended amounts of water and other sport drinks. You need to replenish salt electrolytes as found in sport drinks during prolonged periods of activity or when you are perspiring more heavily in order to maintain healthy blood pressure. Now, after discussing the risk factors of low blood pressure, here comes the complications of low blood pressure. Risk of falls is the biggest complication of low blood pressure. The potential for falls is frequently followed dizziness or fainting. Older adults frequently experience this problem, especially those who are weak. You could sustain serious wounds, broken bones, or a shock if you fall. The wrist, hip, shoulder, arm, knee, and ankle are the bones most frequently broken in falls. A fractured wrist is typically the consequence of someone reaching out their hand towards the ground or the floor to try to break a fall. You could shatter a bone in your knee or leg if you fall forward. Another complication of low blood pressure is heart failure. Another potential side effect of low blood pressure is heart failure. To pump more blood to the rest of the body, the heart has to work much harder and faster. Heart failure may develop if the heart overworks itself too frequently. Now here is another complication of low blood pressure, and it's actually organ failure or stroke. Shock may result in organ failure or a stroke. Your organs will stop working if your blood pressure falls to the point where your body goes into shock. You may be at risk of having a stroke if your brain doesn't receive enough blood. It has been suggested that the brain injury and cognitive impairment are caused by low blood pressure. Systemic hypotension with decreased cerebral blood flow has been linked to ischemic neuronal injury, notably in watershed areas of the brain, and may also result in myelin loss in the white matter. Another complication of low blood pressure is the effect on your baby. Low blood pressure might hinder the fetus' ability to get a steady flow of blood. Low blood pressure during pregnancy has been linked to stillbirth and brain impairment in the developing fetus. Thanks for watching the video. If you didn't subscribe my channel, then click on the subscription button. If you want to know more about blood pressure, then click on the link given in the description below.